bringing them together puts scientists at a very good position of coming up with quite innovative products that can be delivered for different problems and solve different challenges out there. And this is why we live now in a time where you cannot call yourself a chemist. There's nothing wrong with that. But I usually encourage my group to not, because my group is, as you can imagine, very multidisciplinary. Exactly. So I encourage my team to not call themselves chemists or physicists or mathematicians. We are scientists. That's what brings us together. And your being a chemist is actually very required and useful to me as a biologist so that we can talk a language that can help communities out there. You know, because how a biologist is trained is totally different to how a physicist is trained. They are both scientists, they are both important, but their training and how they are taught to think is totally different. So if you marry someone from biology and someone from physics in a field like photonics or biophotonics, you get,
incredible.
You get amazing results. The World Health Organization has actually shown research that shows us that there's a lot of counterfeit or substandard medication that comes into Africa, particularly drugs for malaria, for TB. Those are all the counterfeit meds that people have to that people find themselves exposed to. And this is because in some countries, for example, as medication is brought into the country, let's say imports are brought into the country, meds are not necessarily screened before they get dispatched. So you find that a lot of medication that is actually substandard ends up in the hands of the societies, which then consume, which then have to consume in certain instances chalk that you use to write on the board. So people are consuming meds, but they're not getting better because the medication they are taking does not have the active pharmaceutical ingredient that is required.
If you value evidence-based thinking in a time that often feels post-truth and you want to hear directly from scholars doing real work, subscribe to the Solomon Atah Podcast. Like this video, join the conversation in the comments and share it with someone. Your support helps us bring more PhD voices onto the platform. In this episode, we host Professor Patience Mthunzi-Kufa, a pioneering South African physicist whose work in photonics and biophotonics is redefining how we detect and understand disease. From optical cell manipulation to point-of-care diagnostic technologies, her research sits at the intersection of physics, medicine, and industrial application. We explore how frontier science can be translated into scalable solutions for Africa and the world, and how deep research can seed entirely new industries. My guest is Professor Patience Mthunzi-Kufa, a distinguished professor at the University of South Africa and a pioneer in photonics and biophotonics, leading the Photonics Center at the University of South Africa. She is internationally recognized for advancing laser-based optical technologies to tackle urgent health challenges. Professor Mthunzi-Kufa is a recipient of the Order of Mapungubwe in bronze, one of South Africa's highest national honors, awarded for her contributions to biochemistry and biophotonics. She has also received the T.W. Kambule NSTF Researcher Award for developing photonics-based diagnostic devices for diseases including HIV-1, tuberculosis, and COVID-19, and was named among Forbes' 10 youngest power women in Africa. The Solomon Atah Podcast with Prof. Mthunzi-Kufa starts now. Good morning, Prof, and welcome.
Good morning, Solomon. Thank you so much for having me. What a pleasure to be invited.
Thank you so much for making the time to talk to us. I'm speaking to you from Cairo. Where are you talking to me from?
I'm talking to you from the, I wanted to say the Republic of South Africa, but it will sound very wrong. I wanted to say that as a joke, but I'm talking to you from Tshwane,
Okay.
In Gauteng.
Okay.
And yeah, the weather is a bit gloomy. It's
Okay.
a beautiful day though with lovely morning rains.
Absolutely. Very fresh. I'm sure you can see the union buildings from your window because I know that Tshwane is where the seat of power.
Yeah, no, I cannot from exactly where I am, but I'm not too far from there. You're right.
Fantastic. Fantastic. Prof, before we get into the questions of the day, maybe you want to just take us back a little bit. To what extent does pursuing a PhD and continuous research work shape not just what you know, but who you become, particularly in relation to how your work becomes products and real-life applications that improves people's lives?
Okay, thank you so much. That's a very important question because not only does it touch on what a person becomes after a qualification, but why it's important for us to get educated. You know, education is one of those powerful keys that unlock so many doors, not only for the one that gets the education, but for communities around that individual as well. So it's very important. And obtaining a PhD, particularly I would say in a rare field in South Africa, like biophotonics, was a very special thing for me.
Absolutely.
When you look into my training, I wasn't a laser physicist from the beginning. I mean, I only started doing physics when I got to university. Okay, we did physics at high school, but when I got to university, that's when I started to focus more on physics, but I became a specialist when I was doing my PhD. So my training, for example, went all the way to a medical biochemist at master's level. And then after getting that medical biochemistry master's, I worked for the Council for Scientific and Industrial Research for a bit. And I was based at the National Laser Center. At the time, it was called the National Laser Center. And I was offered an opportunity to then go and study the PhD in physics so that I could start the biophotonics research in South Africa. So I then had to, translate not only from a bioscientist, but to becoming more like, a scientist in the physics regime, which was very, very difficult.
I can imagine.
It was very challenging. Yeah, it was very challenging. So when I started my PhD, you can imagine my supervisor had to sort of like caution me to the fact that if we are to realize a successful PhD in physics, then we would need to revisit the fundamentals and do so quite thoroughly,
I see.
So he threw me right in the deep end and said, for you to be able to get a good PhD in physics, you would need to teach physics to first years. So I taught physics when they were doing their lab practicals. I would teach them, and then I would also get an opportunity to assess their scripts. Exactly. And then aside from that, he said to me, take a master's in physics for non-degree purposes so that we can really sharpen those fundamentals. So fundamental research, in as much as sometimes it can be looked down upon, is very important, because without fundamental research, you cannot really get to a point where you have nice ideas for applied research. So you can see now, even from that translation, that the work that I do and also getting a PhD has positioned me in a very unique spot where I have got training in the bio sector, but also in the physics sector, which then makes it easy for me to marry the two disciplines in order to do research that can solve real life problems.
Incredible.
Right? And not only am I the one benefiting, but the ones that I'm training are also right at the, I would say at an advantageous position of that training, because now they get to be working with somebody that not only understands the physics or the biology, but understands both and can converse across the spectrum. And that's a very rare fit in a lot of scientists, And it's very precious for me. So getting a PhD is that one thing that I am totally actually very proud of, because it has put me in a very good position of being able to take others with me, and also to generate ideas that are very impactful, that can actually be applied to our societies directly.
So just as you're responding to this first question, Prof, I observed that there's already very foundational aspect of interdisciplinarity happening there between physics and biology. Do you want to just stay a little bit on that and just show how, because you've also just mentioned how unique and how important that is, and show whether is that an inspiring aspect of research work that even new students or new researchers need to look into, how they can combine systems together?
Yeah. Let me say this first, Solomon. Physics usually is perceived to be a very difficult subject, right?
Yeah. Well.
And that then makes it sort of like unappealing to a number of people, right? So the research that I do, and also mixing physics with other disciplines, makes physics very attractive, because now it allows scientists and aspiring scientists to actually see how physics can be used in a tangible way to actually solve health problems, to solve various types of problems, agricultural problems, to get into the water space, and to make devices that can help us with improving the quality of water, for example. Make devices that can allow us to generate clean energy, and also to be able to be players in that sector. You understand? So you are actually showing scientists as well as aspiring scientists what can physics be used for that is actually meaningful to societies. Right? And once people understand that, then physics and photonics becomes that attraction. And this is why I also love taking my physics and photonics to high scholars, right? Because once you can show high scholars what can be done and achieved using physics, then it's like unlocking so much potential also in them to say, wow, if I can be in that field and be able to design ABC, then really it's something to pursue.
It becomes very practical, very tangible.
Exactly.
Yes, almost in our hands. Okay, thanks, Prof. Let me take you to question number 1 now. Your research sits at the intersection of physics, photonics, and real-world societal challenges. How would you describe the central mission of your work today?
Okay, so at its core, my work is about translating photonics from a purely laboratory-based science into a practical technology that solves pressing societal problems, right, Solomon? So we use light-based tools to design affordable, but also portable and impactful sensing as well as diagnostic and monitoring systems, particularly in resource-constrained environments, right? The mission is not just scientific discovery, right? But usable innovation that improves the health outcomes and also strengthen food security in terms of the agriculture sector. It protects the water resources and it also supports sustainable energy, right? So the idea really is not to do research for producing dissertations in terms of master's students or theses for PhD students, but we want to do research that is impactful, research that can be used by real people to solve real societal problems. Yes.
Just take me into it, because I would like to become a physicist. Prof, define some terms for us and maybe separate. Yes. What is photonics? What does it mean when you as a physicist says photonics? And then
Photonics.
you also then combine the other one says biophotonics, so that
Okay.
I can understand and our audience can understand, Prof.
Okay. So photonics actually is the science of the generation, the manipulation, and the application of light. Okay. So photons are a building block of light. So if you put many photons together, they make you a light ray, right?
Okay.
And that light ray can then be used in several ways. You can use it for studying intricate processes within a cell, for example, and then you can inform the next person of the molecular composition of that form or of that cell, sorry. To say this cell has got a disease or this cell is healthy, and you are using light to actually interrogate the composition of that particular cell. Remember, our body is made up of cells, right? I said the ray of light is consisting out of photons, but our bodies consist out of what? Cells. So for us to be able to look into the body and inform whether the body is healthy or not, we using the light, right? So photonics is actually that science of using light, generating light, and manipulating light to be able to apply it in various sectors.
Incredible. So, for example, when you look at something, when a medical technologist, for example, looks at something under the microscope, they are using light to look at what's happening.
Precisely. So you can either be using upright or inverted light, right? To actually zoom into very, very minute structures, like structures that you cannot see with your naked eye or even wearing glasses. But you are zooming into like tiny, tiny particles. That light helps you to actually zoom out and be able to see and detect.
Incredible. I like it so much. You lead research across multiple thematic areas: health, agriculture, water, nanophotonics, and energy. Why photonics as a common platform, Prof?
You know what makes photonics a common denominator is its incredible versatility.
Okay.
Right? Photonics is very versatile, Solomon, right? It interacts with matter in highly specific but precise ways, right? So photonics, the same optical principles that help me to detect a diseased biomarker are applicable to assess the quality of soil or the quality of crops or even monitor the quality of water. Right? It's the same principles that you can apply across the sectors.
Yes.
Exactly. You can even improve solar systems using the same optical principles. And that's what makes photonics a common denominator that's so special. By building a strong photonics foundation, we create a technology platform that can be adaptable across the sectors.
From health to agriculture to
water, to energy, to making nanophotonics, right?
And I've spoken to academics here, and I've spoken to another one that keeps referring to nanotechnology. You can't see with your naked eye, of course. So these are all disciplines that are intertwining somewhat.
Yes, they are. And, actually bringing them together puts scientists at a very good position of coming up with quite innovative products that can be delivered for different problems and solve different challenges out there. And this is why we live now in a time where you cannot call yourself a chemist. There's nothing wrong with that. But I usually encourage my group to not, because my group is, as you can imagine, very
interdisciplinary.
multidisciplinary. Exactly. So I encourage my team to not call themselves chemists or physicists or mathematicians.
Yes.
We are scientists.
Yes.
That's what brings us together.
Yes.
And your being a chemist is actually very required and useful to me as a biologist so that we can talk a language that can help communities out there. Because how a biologist is trained is totally different to how a physicist is trained. They are both scientists, they are both important, but their training and how they are taught to think is totally different. So if you marry someone from biology and someone from physics in a field like photonics or biophotonics, you get,
incredible,
get amazing results.
Absolutely. I can imagine when those interdisciplinary collaborative ideas come together. In healthcare specifically, what excites you most about photonics-based diagnostics?
It would be the potential for rapid, non-invasive, and label-free diagnostics at the point of care, right?
Okay.
And by point of care, I mean wherever the patient is. It doesn't have to be necessarily in a formal hospital or clinic setup, but it can be lying in bed somewhere, in a rural area. Right? Instead of sending samples to a centralized laboratory and waiting really for days, because the turnaround time sometimes for you to get your laboratory tests results is too low. But photonic system can provide immediate information.
I see.
Right? And by getting immediate information, we then are at a position of advantage where we can stop the disease right on its tracks, right? And also prevent quick disease progression, okay? Because disease progression can then lead to loss of life, right? Especially in rural areas or in under-resourced settings. So early detection saves lives, it reduces the cost, and it also improves the equity in healthcare access.
So, Prof, in future, are we looking at how interdisciplinarity itself becomes a discipline? Is that the way we're looking?
It would be fantastic. That's one of my dreams.
The study of interdisciplinarity.
I tell you, that would be like really
especially
top
as we
level.
imagine solutions that are effective within resource-constrained environments. I think
exactly.
Yeah. Your work emphasizes solutions for low resource environments. How do you design technology differently with that context in mind?
Okay, so the aim is actually to start with the end in mind. So what is the end product, right?
Okay.
We design with constraints from the stats, right?
Okay.
Devices must be portable. We know that. Devices must be robust, right? We know that as well. They must be affordable. And they must be easy to operate without specialized infrastructure or trained personnel, right? You need to give it to anybody and they need to be able to run with it. So that's what we start with.
Okay.
Of course, we consult with guiding policies that tell us what kind of credentials do devices need to have so that we can then, when we go to the drawing board, come with exactly that approach in mind, right? And if you design devices like that, then it means fewer reagents are required, okay? Minimum maintenance is also required. An advantage.
Yes.
Exactly. And simple interfaces are also acquired if you design devices like that. Innovation for us is not about sophistication alone. It's also about appropriateness, right? And usability. With usability right on top of the list, right? If a technology cannot function where it is most needed, then it hasn't truly been successful, right? You have not really succeeded in designing anything if it cannot answer the actual questions where it is mostly needed.
Prof, I see even in the introduction, there was something mentioned about tuberculosis, HIV-1. Are there some devices that your lab has actually sent into the public? If it also mentioned COVID, which you can walk us through and what the feedback has been and what the response has been in terms of how they have been used?
So there's been quite a few that have actually advanced in their technology readiness levels.
Okay.
They are not really being tested in the laboratories or in the real life settings yet.
Yeah.
But they are very well on their way there. I must tell you, one challenge about translating research from the laboratory benches to the to commercialization, right, to the market, is very, very bureaucratic, right? So you find that there's a lot of time, especially if you start by doing the research before you put, proper industry partners and policy makers in place that will help you to take the research all the way out. So we find ourselves in a situation where we have the devices, but because of everything that needs to be done before they are tested out there, there's a delay. So these are all the lessons that we are picking up on the way to ensure that going forward and really progressing with the research translation, we also save ourselves some time.
Absolutely. I think I have a question here, a full one, which I think is still going to tease out for me. So you supervise students across several photonics themes. How do you cultivate interdisciplinary thinking in your lab?
Yeah, so we intentionally create teams that blend physicists, engineers, application scientists, you name it. I intentionally do it, right? The students are encouraged to understand both the fundamental science and the societal problems they are addressing, okay? Because you need to know where the science is going to be useful. Remember, I said even from the beginning that as soon as a person gets where their work is essential, then it really excites them, all right? When someone is designing an optical sensor, understands the realities of a clinic or a farm, their solution becomes more meaningful, okay? And it becomes more deployable as well. So interdisciplinarity is not an option in the fields like the one I'm in. It is actually quite critical and essential. And so when we are designing teams, we are designing with that in mind, and it's quite intentional.
And of course, I can imagine that the outcomes are very different from perhaps teams that have not really incorporated that collaborative interdisciplinarity aspects. Because if there's been an overarching area that has been identified, and this team is now working, I can just imagine the quality of outcomes that will come from even if these are just PhDs, even if these are applications, even if these are products, in terms of how the society takes them, receives.
Exactly. So not only interdisciplinarity in terms of human resources, but interdisciplinarity also in terms of the laboratory setup. If you've got that in-house, it really sets you at a very good position of being at the top of your game, because you can consult in-house as well. There's very few, I'm not saying external collaboration is not useful. But what I'm saying is internal discussions already have got an advantage of advancing even before you consult outside, So it's very important. And that's why I'm saying it's something that is a requirement and it's essential, right? It's not something that we just find ourselves in, but it's very intentional.
Absolutely. Nanophotonics is often seen as highly technical and abstract. How does it connect to real-world impact, Prof?
So nanophotonics allows us to control light at extremely small scales. Remember I said photons build you your light ray.
Yes.
But now that light ray can also be manipulated to becoming extremely small, which dramatically enhances the sensitivity and the efficiency of whatever analysis and assessment you use that light for. All right. Then it translates directly into better sensors, whether it's for diseases, for water quality, for picking up counterfeit medication, right? You now have your better sensors. You've got faster diagnostics, right? You also have more compact devices, right?
Smaller in sizes, yeah.
Exactly. Imagine if you putting your technology in a cell phone.
Yes.
Smartphone or whatever, a small device that can be handheld.
Yes.
And this is used for impactful health benefits, So nanophotonics gives you that, okay? And that's why we are also delving in the field of nanophotonics. So while the science is advanced, the outcomes are very practical, So smaller, cheaper, and more powerful technologies that can be deployed widely. That's
Prof,
what nanophotonics gives you.
Yeah, Prof, you mentioned something that's really important. Health, and I'm looking at nanophotonics.
Yes.
And you just said something along dictating fake medication. Can you just expand a little bit? Because that is something that's very prevalent, especially counterfeit. Say fake. You use the word counterfeit medication in under-resourced area. Yes. So can you stay on that a little bit and just kind of expand?
So the WHO, right? The World Health Organization has actually shown research that shows us that there's a lot of counterfeit or substandard medication that comes into Africa, particularly drugs for malaria, for TB, those are all the counterfeit meds that people have to, that people find themselves exposed to. And this is because in some countries, for example, as medication is brought into the country, let's say imports are brought into the country, meds are not necessarily screened before they get dispatched. So you find that a lot of medication that is actually substandard ends up in the hands of the societies, which then consume, which then have to consume in certain instances chalk, chalk that you use to write on the board.
Yeah.
So people are consuming meds, but they're not getting better because the medication they are taking does not have the active pharmaceutical ingredient that is required, right?
Yes.
So with photonics, we are able to screen medication.
And see the compound,
we did that research extensively in my previous lab that was based at the Council for Scientific and Industrial Research, where my team would actually, look into different types of medications and their composition, and then we could actually inform the molecular structure of, for example, ARVs. Right? We can screen it, tell you exactly what it is, and tell you the concentrations as to which the different ingredients appear, and also inform whether it's degraded or not.
I see.
So we can actually pick things like the expiry of the products, right? And we can actually, apply photonics in that. And this is why I love being in the field of photonics, because it gets to do impactful research such as that. The idea there was to build bulk screening tools that would be put at the seaport or the airports of our countries, and do bulk screening of the meds as they come into our countries, so that we know that as soon as it hits wherever dispersion or points of dispersion, then they are good enough to be consumed.
Prof, where does artificial intelligence fit into all of this? Because it's already very, if I have to use the word, fancy and very technologically advanced in itself. where does AI fit into your work, Prof?
I love that question because it fits everywhere.
Okay.
We've already started using AI in various sections of our projects. In certain instances, we are writing apps that will, instead of actually having an actual device that can be used for diagnostics, you can actually use an app. If you give it all the necessary information, then you can actually diagnose using an app, right? It's a dry type of it's a dry run type of screening, but at least it gives a patient, especially patients that are in really poverty-stricken environments, it gives them an advantage of at least getting some form of dry screening before they get to the laboratory. Okay, so AI fits in quite perfectly. Machine learning, we've used it a lot in instances where we actually teach the different algorithms how to read, for example, spectral data that we have generated in the lab. Okay, so you can use algorithms to read spectral data, and that puts you at an advantage where you are actually doing work faster and you are getting the desired outcome quicker.
Yes. Probably you can say I'm a little bit distressed because I've traveled, I've been very privileged to travel a little bit in the continent. And I observed that you see medicine stores, if you like, and you cannot help but wonder whether have all of these stores that sell medication, have they really, are these medications all checked? Are they all sane? And you've already pointed it out that some of them are not entirely safe, even for companies like chalk that we use to write on this. So that's why I'm feeling a little bit distressed as you explained it, which is inspiring, because when you say we can put it as an app where you can scan a box, you can even have some basic knowledge about the product. That would be absolutely wonderful.
Very useful. Sorry, just to your point, medication is just like food. How you store it is very, very important. For example, sometimes in our setups, especially the outdoor markets, you find that there's a stall of medication that gets packed out on a daily and packed back maybe when the people knock off in the evening. But the way that medication is being handled, it makes one wonder, is this medication still fit for human consumption? And then you also get herbal medication that our African people are also very fond of, from the traditional healers, right? Which has not really been characterized as to what the active pharmaceutical ingredients are for a root maybe that has been just dug out of the ground, or a leaf that has just been picked from a tree. Although these things have been maybe out of experience used and have been proven to work, but we don't know the level of toxicity. We also don't know how much in terms of dosage needs to be given to a patient. You understand? So this is where our research of photonics and where our application of AI also comes into the fore. To be able to understand things like that, we are taking hands with traditional healers and all sorts of people that have got knowledge in African herbs and in herbs that are indigenous, to actually characterize those so that we can have like an information leaflet for those as well,
Absolutely. This makes you must be having a lot of fun doing what you do, Prof.
It is. And the nice thing is that we discover new things on a daily. So you never get bored,
Yeah, I can imagine. How does your research contribute to sustainable development priorities globally? I think these are some of the SDGs.
Yeah. So our projects actually align very closely to that, because the SDG is one of those guiding policies that we have to find a way of aligning to, particularly those related in health, in clean water, in food security, as well as clean energy, right? We focus on enabling technologies that strengthen rather than isolate solutions, okay? The goal is long-term resilience when it comes to SDG, right? Technologies that communities can sustain and adapt themselves. Yeah.
Okay. Many researchers struggle to move from publication to products. How do you approach translation and commercialization, Prof?
So I will say from the very beginning, we ask the following questions.
Yes.
Who will use this, right? And how will they use it, all right? That mindset then shapes the design partnerships and the validation pathway, okay? We collaborate with clinicians, with different industries and policymakers early on in our research, all right? Publications are important, of course, and wherever possible, we try and work our applied research as well as our fundamental research in parallel, right? But real impact comes when a device leaves the lab and starts to enter the field and create impact in the field, okay? Absolutely. So translation must be intentional. I'm saying this again, rather than accidental. So that's how we approach it.
I can imagine. Is your lab open to people from the public to just come and have a look and see what?
We do host people from the public. Of course, there's protocol that needs to be adhered to.
Yes.
But of course, I mean, and this is why I love working also with high scholars.
Yes.
Because then we get to host them in our labs. We get to also
because I was going to ask that. Yes.
Programs. Yeah, we get to have programs like your job shadowing programs where you get, maybe 4 students coming in and shadowing scientists.
Yes.
So yes, it is very much open to the
which
public.
means like a high school can book and go through the protocols and say they come to. And are these visits, are they free or are there fees involved, or is there any? What are the protocols for the high school to come say hello? To come have a look around, to come and learn?
So one of the things that gives me the greatest satisfaction is having done something that makes another person happy, or another person, like something
Curious.
that makes another person find joy in especially science and research. So I'm very happy to open my space up free of charge to have learners come and see what is being done by scientists and how they themselves become those scientists and help in making a difference in life.
Absolutely.
So no, it's not paid for, as long as there's a proper arrangement in advance, so that our scientists are ready and we open up the lab such that it's safe for bringing outside visitors. There's paperwork that needs to be signed, and as I said, a whole lot of other protocol that needs to be adhered to. As long as that's done, we are very happy to host.
Fantastic. As a mentor and research leader, what legacies do you hope to build through your students? I think you're already on this question, Prof.
Answered that, yeah.
So looking ahead, what is your vision for photonics in Africa and the next decade or two?
There are so many opportunities in Africa. It excites me so much. I see Africa not just adopting technologies, but actually creating them. Especially with everything happening geopolitically right now, we really need to be, as scientists, we need to be in a mind frame of creating solutions rather than adopting solutions from elsewhere, So photonics can underpin new industries in health tech, in agri-tech, in environmental monitoring, and in renewable energy as well. So with the right investment in research and talent, we can become producers of high-value technologies rather than consumers of those high-value technologies. My vision for Africa is to lead in the context-driven innovation that the rest of the world can learn from.
Do I still have to ask you for final thoughts, Prof? Final thoughts.
Yeah.
And in the final thoughts, perhaps you want to tell us the future of final thoughts. I always ask for like role models, people that have inspired your work, people that you look up to, and of course, what else is keeping you awake at night? What problems are you solving, Prof? Or trying to solve that? You've been looking for the solution, is just very close.
So as I said, some of our products are really within touching distances of getting into the market.
Okay.
But aside from that, I think my greatest wish, and I'll get this eureka moment when I can see that we've generated human capacity, like capacity development that does not expect to get solutions from elsewhere, but are actually solution bringers. Because if we've got such mentality within our scientists, our engineers, our clinicians, etc., then we are at a very good position of actually even creating jobs, because there's a lot of requirement for job creation out there. So we can create jobs, we can, be in a position where we can also improve our own GDP using our own technology in Africa, and we can be in a position that where Africa is relied on as opposed to us relying elsewhere for solutions.
Professor Mthunzi-Kufa, thank you so much for being on the podcast.
Thank you. Thank you, Solomon, for having me. It's really been a pleasure.
Absolutely. Thank you so much for watching this episode. If you have benefited something from this episode, please subscribe, share, like, and comment. It helps the algorithm show this video to more people.